Good morning. I'm feeding again. They gave it to somebody else. Now I'm back to doing it again. So yeah, we'll see how it goes.
I got you. So your role is feeder again.
Yeah, my role has changed in the last several weeks from this to that to that to that and back to this. So I'm about to feed Sage. Sage lost a tooth a little while ago, so she's on some medication for that, and I got to put it in her feed and I got to soak the feed. So I'm kind of mixing it up right now, and then I'll walk over here and get some water. Yeah, it's just powder, so shove it around and then we'll walk over here and get some water in it. I think there's one over here that we can use. Alright, we'll mix that in and try not to lose it on the way back. I'm gonna let that soak just a little bit while I lose all the hay on the ground. Okay, we'll do it that way. All right. These guys are young, so they get mare and foal. These guys get senior feed and alfalfa pellets. The bag has been decimated. It was hit by a forklift before we unloaded it, so we had to lay it flat, and we finally got down to where the bag was. So. We emptied some fields out last week. We moved horses around and stuff so that I could spray the fields with our weed killer, because the little yellow flowers, I don't know what they're really called, but some people call them buttercups or something like that, come and they take over the field. And they're supposed to be toxic to horses, but the horses don't eat them, but they will override the whole field. They'll take over the grass and everything. So I go around and spray, and I was trying to keep on top of it this year. Got everything hooked up last week to spray. Hooked up to the battery, which is sitting down here in the cart. Flipped the switch on, nothing. So I figured I'll check all the connections, because there's a couple different connections that get plugged together. Everything was fine. I got back to where the motor was and went to wiggle the wires on the motor, and one of the wires was just laying off. It had broken off at the switch with not enough to fix it. So I had to order a brand new switch. Said it was online, or was in stock online, you know. Ordered it, next day come in, got an email from the company. The switch is on back order.
Oh no.
So we don't know when it's coming in.
Well, geez.
Yeah, so I've got empty fields waiting to be sprayed, and I'm not able to do it. So,
well,
yay, the life of me. Oh. Alrighty, so I'm off to the next adventure. probably putting out around bales. I think a couple down in general population need it. Everything up here looks like it's doing pretty good for today. So off and going.
We have Wally here. He is sedated. We were just doing his intake on him, and his belly felt a little abnormal, so we were just doing some x-rays to see if anything looked odd in there. We might ultrasound it, see if there's any free-floating fluid in there. But otherwise, he's looking pretty good. His teeth look good. FIV and FELV tests were negative. So as long as his x-rays look good, we'll give him his vaccines, give him some sub-Q fluids just because he is a little bit dehydrated. And then he'll be good to go.
Or maybe his right kidney, I mean, because his left kidney's over here, but it's...
So you want him this way?
Yes. So I was asking if we could get a different view to try and get him more straight. So when we did our VD view, or ventral dorsal view, where he's on his back, he's kind of lopsided, so it's really hard to see all the structures. But on the lateral side view, if I can get there for you to see it, it's kind of hard to see, but soft tissue superimpose on each other and they amplify. So there's like a structure right here that's really large. So I'm trying to decide if that's kidney or if there's a mass. Gotcha. So I think it might be his right kidney. Because on this view, you can see the left kidney and it looks normal-ish in size. It's got a really irregular border, but you can't see the right kidney. So I'm trying to get a straighter view of this to see what it is. So that might be what we're seeing push everything out.
If that is it, it's rock hard.
Yeah, but you know, they have to lose like 75% or more before you start seeing those changes. So it's like...
Yeah, his BUN was almost out of normal.
I think that's it right there.
Yeah.
So it's his right kidney is definitely enlarged, or his left kidney is incredibly shrunk. But his spleen also looks pretty big on this view anyway. Mm-hmm. Maybe you should ultrasound your kidneys and see what they look like.
Yeah, let's do it. It's right around that is the squelchy bit.
I'm going to attempt to ultrasound his abdomen and see if I can see the kidneys and all the major organ structures that we look at, and see if there's any free-floating fluid for us to pull a bit off and examine, or an abdominocentesis. On radiographs, it was confirmed that his right kidney is enlarged compared to his left especially, but for the body organ systems, looking at his body size, it's really abnormal. So I was going to try and look at it and see if I could find any reason, like a nephrolith or a little calcium or something in there, and see what's going on.
Oh, we were going to x-ray his toes. He does have like a weird little...
Like little bump.
I think, isn't that a leftover nail?
Very well could be.
Just litter? It's...
I wonder how recently he was done.
Definitely looks like it's coming out of his toe.
Yep. They didn't get all of it.
What is it?
A little bit of bone left. So when he is declawed in all of his front toes or his front digits, and so when that happens, what they're actually doing is removing the very end of the phalanx. So it's P1, P2, P3. So when we talk about horses, we talk about P1, P2, P3, but we're actually removing P1 in the cats, and that's the one that the nail grows out of, or the claws. And sometimes if you leave a little bit behind, it'll still grow, and it can create a lot of pain in the digit. It's not a super easy surgery to do, but so he's got a little bit of growth there. So we should probably x-ray that, and maybe if we can keep him, help get rid of that pain for him. Maybe give him a little blocky block. All right, let's see if I can see your kidney. There it is. Right there. Yeah, it's definitely got some increased opacities. I'm gonna see if I can. Where'd you go, kidney? Come back. Maybe I can do this. So many beeps going on.
I know.
Just like, what is that?
I think that one's the autoclave.
Oh, okay. There it is, up there at the top of the screen.
Right there?
Yep. So that little bit looks a little enlarged in the center with the decreased opacity or like more like liquid or fluid, but there's definitely like a nephrolith or something in there.
Like the little white spot that pops up?
Mm-hmm.
Okay. Right there?
Yep. So when I go up, slip back up where it's not supposed to be. Do you see that big, there are big gaps in it? Or big like
In it?
fluid? Yeah, like lucencies or
Yeah.
decreased. Even though the tissue around it looks thickened too, but there's still a pretty big gap in the middle. Okay, let's see if I can find your left kidney. Take some of that with me. There it is.
Right here.
Yeah, that one looks like it has pretty big renal pelvis too. But the kidney itself doesn't look as. Did we give him his fluids yet?
Not yet.
Okay. After these radiographs, we can do that. And it's a little bit yellow because I'm giving him some vitamin B12. There you go, sweet boy. Hopefully that helps you out a little bit with those kidneys. He's starting to wake up. We gave him some sedation so he could do some imaging and stuff and just not really super stress him out because he's an older gentleman. We did find some concerning things with his liver and his kidneys. And on radiographs, he does have some bony growth where they had declawed him before, which is a not uncommon complication. So he's got a little bit of bones growing out, and that can be really painful post-surgery because they're not supposed to be there anymore. It does alter the way they walk. So in general, declawing is very painful. So we're going to work on some pain management for him that kind of keeps his kidneys and liver in mind. He's got some cataracts, just kind of old man changes, but that's the biggest thing was his kidneys, which isn't an uncommon thing for cats as they age to get kidney changes. Some cats live longer before it gets them, and some cats don't live quite as long. So we're going to talk about it and keep him comfortable, make sure he's got lots of fluids, and just go from there. Yeah, he's super cute with his little cataracts.
You want to give me a quick explanation on what you're doing, Alan?
Introduce a rope to a horse here. I haven't introduced a rope to this horse yet. This is one of my new ones. My newest one so far. Only got one trained horse after this one. It's ready to be doctored. Other than that, it's good. It's good. Good deal with this one out here. Good boy. The reason I warm up the horse is so it don't injure itself. The horse is like jeans, he's got to stretch out before he takes off. A lot of people, they train horses in a different way. They have their own techniques and way of training horses. Me, just like for me, I have different techniques that I work with when I pick up a horse, when I'm working on a horse, depending on what the horse does. If the horse bites, if it kicks, if it bucks, it gets spooked. That's what I really want to get out of them. And this one, he's pretty good on all of those. He didn't get spooked, he didn't kick, he didn't bite, and he stood still when I was saddling him up. I knew I'm doing something right, because when I go riding it, it does everything I want it to do. It turns good, it stops good, it backs up, it stands good. I can lift all 4 feet, and what more do you want out of a horse, you know? Do everything slowly, because it's just not learning. You teach it slowly, not roughly. Because it can feel you, that's what it's going by, feelings. It can see, it can feel, it can hear. So those are the things you want to use when you're training a horse.
I'm going to tell you guys a little bit about Nakoma right now. So we call him our pretty boy because he's got the best mane on the property. He's got really good hair all the time. Every day is a good hair day for Nakoma. He's made a lot of progress in a short amount of time with our gentlers here, and they've done awesome with him. He's kind of short, but he's stocky, so he can carry a good amount of weight, but we would like him to have a rider that fits him well. He does great with other horses because he was in here with Donnelly for the longest and they got along so well, which was surprising because he came in as a stud, so he's a gelding now, but they did awesome together. The gentlers said that he has a great personality. He's never tried to bite, kick, nothing like that, and we're really hoping we can get him a home with someone that has a lot of patience because he is a little energetic and he's ready to go. So if you're interested in Nakoma, go to horseplus.org and put in an adoption application, and hopefully we'll review that and get you a spot to see Nakoma.
So Gray is a Horse Plus resident. He has lived here for many years. I actually don't know how many years, for a good while. And he is here today for his annual exam. So he's gonna have some blood work run. His Coggins test is gonna be repeated. I'm gonna do a full dental exam on him, and we're just looking at him overall. Historically, Gray's lost some weight in winter, even with really proactive feeding. So we're watching him pretty closely to make sure he doesn't have anything going on, but there are no new concerns reported with him. So he just got a little bit of a sedation so I can check his teeth. So I don't always do radiographs as a part of routine exams, but I don't think we did them on him last year, and I don't know that he has any on record. So I feel like at bare minimum, let's do some hock and dental rads in case we have abnormalities present later on. We can use them as baseline. He's got like a little bit of a bony abnormality in the left fetlock too, so. Let me get this mud off of him though. Mud shows up on x-rays. Yeah, you remember this stuff? This is our old dental speculum, which looks like a medieval torture device. And it just collapses really easily. And it's a death trap, and it's really heavy and difficult to work with. And this is our new one. It's like an aluminum alloy, and it's just lovely to work with. And it was very expensive, and it's worth every penny, and I love it. You're not very sleepy. Okay, I was wrong. He has a good bit of, not horrible, but he has a little bit of a hook wave mouth. So he does have some work that needs to be done. I don't want to get you soaking wet. All right, buddy. So this is a really interesting example. If you guys want to double check me. So what happened was he had a hook wave mouth, and we corrected it, and the rate of growth of his top teeth isn't keeping up. So he still has, on his 9, 10, 11 of the upper arcades, he still has a big worn area, but the bottom arcades were still pretty flat from last year. They were little, so his rate of dental growth has really slowed down. Yeah. You're such a good boy, Gray. Yeah, he has almost no maxillary tooth roots left. Beautiful. Look at that. What's going on right there, sir? Oh my goodness. Oh, your bottom teeth. Look, we've got mobility right here. That wants to come out? Yeah. I'm sorry, big sir. We might have to pull those. So we care about teeth sticking out, but we care a lot about roots. So you can see this tooth is mobile up here. Look how far down into the mandible that root goes. So here's the gum line right here. And that tooth goes that much further down. And then these two also are pretty far down. So some teeth, like incisors in dogs, are no big deal. But in horses, we have to pay attention to how far down that goes. And then this is the other area of concern with him. So these are his number 10s. And you can see how this is a pretty normal opacity. See how much, so gas is black, right? So when we have a thinner bone or a thinner tooth, we're gonna have a darker gray appearance, and these two teeth are compromised. And that is because historically he had a really severe hook wave mouth. So this is the wave basically. And you can see what I did today was I just took our dental equipment and I smoothed this part out. But this part hadn't really caught up with the rate of growth. And that tooth right there is the tooth that you're seeing the opacity change. And it's kind of the same on both sides. I know you're a very good boy. So this one, I think absolutely has to come out. This one, feel the second one, still has a lot of strength in it and not a lot of mobility.
All of these are mobile.
Yeah. Like this one I think has to come out. This is causing him pain and he's got food packed up right here.
Mm-hmm. Do you have E-Roth?
But I mean, this root is all the way up here. So this is not going to be a super pain-free undertaking if we want to. But I definitely think this is related to weight loss because he can't graze comfortably.
I'll show you carrots. I'd like to see if he can snap a carrot, because if he doesn't, if he's not able to, then he has E-Roth.
Gray is such a good boy. We're going to try to put the plate in his mouth and take an x-ray up from the bottom so we isolate his lower incisors from his upper incisors so we have a better idea what's going on, which I think is wise anyway. This scenario is the perfect example of our team, right? I'm like, let's get the tools and pull the tooth out. And Nicole's like, why don't we check with Dr. Gina? And Dr. Gina's like, well, we got all these other problems. So it's great. This is why our team provides best care. So we're gonna put our radiograph stuff back on and try to get another image of his mandible so we know exactly how we should proceed. Whoop. Let's see if we got it. Yeah, we got it. Sweet. That looks very diagnostic. Holy moly. This is the left side of his mouth and this is the right side. And so if you look at these incisors, if we draw a straight line right down here, there should be equal halves. So this is the first incisor. This is the second incisor. You can see already in this tooth, there's a big difference in the roots. Mm-hmm. And then this third incisor, yikes. This is the one that's really mobile and has a lot going on.
He might have E-Roth because that looks like hypercementosis.
It really does. So Gray was our perfect boy today. Dr. Gina and I did hold off on pulling his one incisor that's really mobile because based on our x-rays, we have a lot more going on and we want to make sure that we're not causing him discomfort without fixing the problem. So if it was just the one tooth, I would have pulled it out. But because he has a bunch of teeth affected, some of which are molars, I'm not really an equine dentist. I do routine stuff, but I don't feel comfortable pulling those big teeth with the deeper roots. So we're probably going to do a consult with some of our amazing specialist colleagues. And we're also going to talk to management. We are putting Gray on a daily pain medication. So he's going to be getting Equiox. It's a non-steroidal anti-inflammatory drug that's great at reducing pain and inflammation. So that's going to help with the discomfort. And then because horses get gastric ulcers easily when they have other medications, we're also putting him on omeprazole, which is a product called UlcerGuard. UlcerGuard actually donated a bunch of their product to us. So we're very, very grateful to have that. It's quite expensive, but that's going to help protect his GI tract. Almost all of their immune cells live in their GI tract. So GI health isn't just important for maintaining weight, it's important for their whole immune system. So we're gonna get Gray comfortable today. He's just gonna get turned back out, but we're gonna discuss his treatment plan and hopefully come up with something that will keep him comfortable. Depending on what definitive diagnosis he has, he may end up progressively losing tooth after tooth after tooth. So if this is the equine resorptive disease that Dr. Gina mentioned, he's gonna continue to have problems. And a lot of those horses end up having all of their teeth pulled, which is really, really difficult to maintain. But if it's just a one-off and he just fractured this one tooth and he just needs a couple more pulled, we may be able to get him all the way comfortable again. So we will find out and keep you guys posted.
This is Duke. He's a less than 1 year old mixed breed dog. We're about to neuter him because hopefully Megan from High Forest Shelter will take him. He's out. Okay. You're definitely young. You got beautiful teeth. Yeah. I wonder if you were positive for Ehrlichia or Lyme because you are very oozy.
I don't think he was. It just says negative,
Yeah.
but I'm not sure which test they did, if they just did heartworm or...
Yeah.
Come on, testicle.
I know. I feel bad doing this part because it's so pressured. But it's important. Okay, there you go. Okay. How's he doing? Good. Great. Gross scab on his chin. That one's done.
I'm gonna grab his cage real quick.
Okay. Okay. The light's like, I give up.
I messed with the like wires and stuff. I don't know.
I don't know what's...
Oh, the like bulb is
Yeah, it's getting...
dimmer.
Yeah. It's giving up. It's okay.
Nicole, I saw you were holding his paws. How does that, I'm guessing that indicates if he's coming to or not?
It can, yeah. Like you can do like a toe pinch. And then I've been kind of poking his eyes a little bit here, like at the corners. If you tap at the corner of their eye, if they start reacting to that, it means the drugs are starting to wear off. So depending on how far along the doctor is in surgery, we might put him on the gas just to get him back under if they still have a little while. But if he's, starting to react just a tiny bit and she's almost done closing or something, then we just let him keep waking up because it could still be a while before he even wakes up. And we don't have a great setup for big dogs. We have the Shoreline kennels in the other room where we prepped him for surgery. Cats and little dogs fit great in those. So we'll use those for recovery, but otherwise, like the big cage I dragged in, we just keep a couple of those in the hallway for the larger dogs, and then we'll bring them in as we need them, because obviously they don't fit great in the hallway either. But until he's fully awake, sternal, not flopping around, he'll stay in here so we can keep an eye on him just to make sure there's no complications.
Look at that, beautiful. Thank you. I'll probably just do one interrupted here, I guess. Come on, Ian. Don't want to crush you.
Yeah, still out. Oh boy, it's gonna take a while to wake up.
Beautiful. Oh, nice.
Here you go, dude, nail trim. I don't think you'd be very good for that awake.
Probably not. Very wiggly.
So how did the procedure go?
It went great. Duke is mildly starting to finally wake up. We just finished his surgery, gave him a nail trim while he was under. Everything went normal, so he should wake up soon and then he'll be all set.
Oh my goodness. Do you need a brush? This is Horse Girl ASMR. Are you mad? Are you so mad at us? I know. I don't think we're gonna make her bald. But this should be like our really last cold day, hopefully. So, we don't want her to get hot. So this morning we got Catori up and vet team's gonna look at her because she's had a few people interested in her. She actually had adopters come 2 weeks ago that we're gonna adopt her out, but she had some lung sounds and we wanted to be sure that she was 100% ready to go before we sent her off. Unfortunately, they didn't get to take her home that day, so we're gonna check her again and we're just gonna see if she's improved or not improved, which we're thinking and we're hoping she has improved, so. She looks like she blew up because we've been brushing her.
Hi, Mama. Are you losing your winter coat? Oh, you do need to be. Is she halter trained at all?
Nope.
Okay. Do you think we could get a halter on her so I can sedate her IV? If not, I can go IM and we can just wait a couple more minutes.
Well, Tito did ride.
I mean,
Okay.
he sat on her, didn't he? Yeah.
Yeah. Do you guys want to try to get a halter on?
Sure.
Hi, pretty girl. We're going to look at your eyes real closely. Oh, you've come a long way with the touching.
Mm-hmm.
She used to be real crazy. Yeah, I'll just give it to her in the muscle, and then we can take a minute. Easy, 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 easy. Okay, okay, you're all right, everybody. Okay. Okay, you want to just hold right there, Alan? Good girl. Okay, now I need to be on that side. Okay, easy. Okay, this medication, if you stimulate them at all, the receptors in the brain are blocked. So we want to just like do nothing for 10 minutes and then we'll come back and see, because once it binds, then she'll be sedated. But if we try to mess with her right now, she won't go to sleep. And obviously that's not going to make her go down. It's just going to kind of take the edge off a wee bit.
Good girl, Catori.
So I actually can do an exam with her right here. This other horse is not super much in the way, but let's get a lead rope on. She can move a little bit. And this skylight is in the exact wrong spot for an opto exam in here. Need somebody to go lay over the skylight. Block that. Okay, good girl. Good girl. Thank you. Good girl. .0. PLR is within normal limits. I know, you got a booger on your eyeball. The cornea, sclera, and conjunctiva and nictitating membrane all appear to be within normal limits. From what I can see of the lens in the posterior chamber, everything in this eye was within normal limits. Did you hear it on the left more than the right? Cranial on both sides?
I haven't listened to the right side, but last time I think it was right worse than the left.
He's got a pinpoint scar on the apex of this cornea that's very small. So I actually can see part of the fundus and optic nerve, and everything looks great and normal. So that's awesome. It just looks like she had a little teeny tiny ulcer on that left cornea. That could have been what we saw when she came in, but I don't have any. Yep, it was right on the apex of the left cornea, and it literally was teeny tiny. I'm gonna palpate the left shoulder first. Hi. She's itchy. She's like, yes.
She's rubbing her bikinis.
I think she's just shedding her winter coat, like these big hunks of hair. I also think these horses used to be just terrified of touch, and suddenly they're like, oh, that feels great. Look at her lips though. Oh yeah, that feels real great. Look, she's really itchy up under here too. This right shoulder lameness was noted when she came in September. But this group used to be, I mean, you couldn't touch them for anything. Everything palpates normally. I don't feel any, look at her lip. She says, oh, that's very itchy. This little mare is Catori. She is 3, I think, and she came in with a group of very sick horses from a reservation. She was cleared from quarantine a couple months ago, and she's been doing great. But we had down to recheck her right shoulder at one point. She was limping, and it looked like it was originating from that shoulder. And we'd also noticed an abnormality on her eyes on another time, but these guys were very, very unhandled and wild. And so thanks to our awesome gentlers, she's had some training. She's much calmer with a halter on. She did get a little bit of a sedation, but not a whole lot. So to do an eye exam, we have to get right up in their faces. So I was able to do a full opto exam today. I didn't see any abnormalities except a teeny tiny little scar on the left cornea, which honestly I think will remodel and go away over time. So looks like she had a little superficial corneal ulcer in her left eye that's fully resolved. She does have a tiny bit of elevated lung sounds. Dr. Gina's stethoscope is way better than mine. So I listened with my stethoscope, didn't hear anything, and with Dr. Gina's stethoscope, we heard a little bit of lung sound elevation, but it's very, very mild. We did collect a sample from her nose just to make double, triple sure, but I'm keeping her in our training program and in our adoption program, and hopefully she'll get a new home soon. She's calmed down so much since she came in, so I'm really happy with that recheck today.
They came back today and got Donnelly. We got him up this morning, cleaned him up real good for his new owners, and we are so glad that he found a home.
When we first came here, we were looking at 2 other mares, but Donnelly just stuck out to me, and I like him. I found out about Horse Plus because when you guys were in California, we adopted some previous horses. And I wanted to adopt because my old horse that I got from y'all, he recently passed, and our other one's a little lonely, so he decided to adopt. I definitely would recommend this Horse Plus to any other horse adopters.
He's done really good with everybody.
Mares.
Okay.
He's been with mares this entire time, and he's kind of more of a follower.
Okay, well that's perfect.
Yeah. But he was so good for us, and he's a fun little horse. So
All right.
Good luck with it.
Enjoy. Keep us updated.
All right.
Yes, we love updates.
Y'all some pictures.
Okay.
Thank you.
He's been in a few of our adoptions, so I was really hoping that they would adopt him out, and that little girl ended up falling in love with him. And he's definitely going to be a project for her, but I think that they're going to bond with no problem. Her mother has a lot of experience with horses, so I'm really excited. They said they'd keep us updated, so we're excited for the updates. That makes a big difference. You can really tell when a horse likes somebody. And at first I was like, I'm not sure how I'm gonna tell that, but they'll let you know for sure, because I really think Donnelly liked that little girl. There's not an adoption I've had where I was like, I'm pretty confident in all the adopters, because I review their applications and I'm very confident with their their people that they go to. And also I love when I get updates because I've had a few and it makes me happy. I call their references, vet references, personal references, ferry references, and also if they have a boarding facility, I check that out on Google Maps. And then I also view their property if the horse is going to be there. I call them once their application is accepted, so we have a personal connection over the phone and I kind of fill them out. So I'm very serious about my applications. I try not to be too picky on fencing and stuff as long as it's there and it's, you know, stable. But I want everyone to get a horse. I wish I didn't have to archive or deny applications. So, but I will. I'm not afraid to push that red button.
Don't mess with you.
Don't mess with the red button.
Hi, I'm Liz. I am the digital advertising and social media marketing specialist here at Plus Humane Society. I joined the team about a month ago. Having a lot of fun. I'm learning a lot. It was kind of a shot in the dark. It was just an email that had popped up. I said, social media marketing, horses, what better combination? I thought I would just apply for fun. And I got an email responding a little bit later, and I mean, I blinked and like now I'm here. I'm from northern Utah, so not super far from home, but I would take people on trail rides over Zion National Park. I never grew up with horses, but I always tried to be around them as much as I could and found myself some opportunities for that. First impression, like when I first came and did my working interview, all I could think was like, this is the perfect place for me. I really appreciated how close everyone seemed to be, and I just loved everyone's interactions with each other. I loved the great environment that they have built here, and it's been a really easy transition coming and working here, and I'm excited to just kind of go with the flow and make better connections with everyone here.
My name is Mike. I'm originally from Charlottesville, Virginia, but I went to school in Tennessee, right over in Cumberland Gap area. So just very familiar with the area. Love Tennessee. There was a big reason why I came back here, and I'm one of the video producers here, and so far I've really enjoyed it here. It's just great people, great experience. I did a lot of long form content over at Auburn Athletics, and that was definitely a different experience, but it gave me a lot of insight of how to tell a story. There's always some story behind them that we can look into, and hopefully through that process, if they get all the way up to adoption, it's so amazing to see. Just today, we just had a horse that was up for adoption, and they had been here for quite a while. So to see that journey was really a great thing to see. So I'm glad I could document that type of stuff.
Hey everyone, thanks so much for watching episode 9 of Horse Shelter Heroes. Don't forget to like and subscribe to our YouTube channel, and hope you all have a great week. Thanks for watching.